Welcome back. Take a moment to get comfortable. Lying down, seated upright with your back supported. Allow your hands to rest softly on your body or by your sides. If it feels safe for you, gently close your eyes or soften your gaze. Tonight, we are practicing a form of breathing known as Buteyko breathing, sometimes called reduced or light breathing. This style of breathing is especially supportive for people who are experiencing snoring or sleep apnea, mouth breathing, or restless sleep. Before we begin, let's understand why we are breathing this way. Because most people think that sleep apnea is only about obstruction, the airway collapsing during sleep. But breathing chemistry also plays a role. When we chronically overbreathe, breathing too fast or too deep or through the mouth, we blow off too much carbon dioxide. And this gas is often misunderstood. It's not just a waste gas, it's actually essential for oxygen delivery. Through something called the Bohr Effect, carbon dioxide helps oxygen release from the blood into the tissues, including the brain. So when carbon dioxide levels are too low, oxygen delivery becomes less efficient. Breathing becomes more unstable, and airways can become prone to constriction or even collapse. Overbreathing can also dry out the airways, irritate your tissues, and increase mouth breathing, all of which can worsen snoring and sleep apnea. So tonight we are going to practice the opposite. Light, slow, nasal breathing. Breathing that is quiet and minimal and efficient. Breathing that actually rebuilds carbon dioxide tolerance, supports your airway stability, and signals safety to the nervous system before sleep. So let's begin. Bringing your awareness to your natural breath. There's no need to change anything just yet. Just notice air moving in through your nose and out through your nose. Noticing how the temperature is a little bit different on the inhale compared to the exhale. Cool air entering and slightly warmer air leaving. Now allowing your jaw to soften. Tongue resting gently on the roof of the mouth. Lips sealed but relaxed. Now begin to gently reduce the volume of your breath, not by holding or forcing, but by breathing slightly less than you feel like you need. Imagine your breath becoming 20% lighter. A softer inhale and a softer exhale. As if you're trying to breathe so quietly that someone lying next to you would not hear it. Inhaling gently in through the nose slow and light and effortless. Exhaling softly, letting the breath fall out of the body. No pushing or forcing. Just quiet release. And as you continue, you may notice a subtle feeling of air hunger. A slight desire to breathe in a little bit more. This is normal. This is where the training happens. We're safely rebuilding your tolerance to carbon dioxide. And as the carbon dioxide rises slightly in the blood, your airways tend to dilate. And oxygen releases more efficiently. And breathing rhythms stabilize. Continue breathing lightly this way. Imagining that the breath is staying low in the body. Barely moving the chest. Minimal movement through the ribs. A soft belly expansion. If you find it easier, you can place one hand on your chest and one hand on your belly. And notice which hand that moves, and aim for none of the hands to move very much at all. Now let your exhales become a touch longer than your inhales. Naturally slow down the exhale. With every breath, feel your nervous system softening and your heart rate slowing and your muscles unwind. When we reduce our breathing volume like this, we stimulate the parasympathetic nervous system, your rest and digest mode. We're also stimulating the vagus nerve by prolonging our exhale. Now we're continuing this practice by adding on a gentle pause. Nothing forced, but at the end of your next exhale, see if you can hold your breath for 2, 3, 4. And then resume light nasal breathing. One more time, inhaling and exhaling. Pausing at the bottom for 2, 3, 4, and take another breath. These small pauses help train the body to tolerate carbon dioxide. And this, when practiced regularly, can reduce nighttime breathing disturbances over time. Continue at your own pace now. Light inhale and a soft exhale. Tiny pause at the bottom and begin again. If you ever feel uncomfortable, you can return to your normal breath and jump back in when you feel ready. As you settle into this rhythm, imagining your airways becoming more open and more stable, with the tongue resting on the palate and your throat soft. Your nasal passages are clear and spacious. You're breathing slow and silent and effortless. You're teaching your body that it's safe to breathe less and slow down, sleep deeply. Now let go of that technique. We're going to add on a hum on your exhalation. So after your next inhale, gently close your lips and another inhale counts. Now let go of the humming technique and come back to your natural breath. Noticing the residue that this left in your body. Perhaps some lingering sensations around your throat or chest. Allowing your breath to find its own quiet rhythm. Still nasal and light, but more effortless now. No control, just observation. Feel the heaviness in your body and the softness in your face. Unclenching your jaw and your eyes are heavy. Your forehead is smooth. And as you drift towards sleep tonight, trust that this breathing is supporting oxygen delivery, airway stability, and nervous system regulation. You are supporting quieter nights and deeper rest and more restorative sleep. If sleep comes, allow it. And if you're still awake, simply rest here. With light, slow, nasal breathing. Telling yourself in your mind upon every exhalation that your body is safe to rest. There's nothing to force and there's nowhere to go. Just keep breathing softly and quietly into sleep.